Assalamu alaikum. Let's talk about ulnar nerve lesion. If we think about the ulnar nerve lesion, if the lesion happened at the wrist, that means low lesion at the wrist, it can happen due to fracture of the hook of the hamate, entrapment of the Guyan canal, compression of the carpal ganglia, ulnar artery aneurysm. At the wrist, what will happen? Unable to spread fingers, which is abduction, unable to adduct fingers, adduction cannot be done. Ulnar claw hand, loss of hypothenar muscle, loss of adduction of the thumb, loss of hypothenar of the muscle, loss of adduction of the thumb, and sensory loss medial 1/2 of the finger. Sensory loss medial 1/2 of the finger. At the elbow, previous things will happen like unable to spread fingers, unable to adduct the fingers, ulnar claw hand, loss of hypothenar muscle, loss of adduction of the thumb, and sensory loss of the medial 1/2 of the finger. Along with there is weak flexion of the wrist and medial half of the finger due to paralysis of the flexor carpi ulnaris and flexor digitorum profundus, flattening of the medial border of the forearm, flattening of the medial border of the forearm. The high lesion can happen at the elbow, it can happen at the axilla. In the axilla, the cause may be crutch or aneurysm of the axillary vessel. At the elbow, the cause may be isolated medial epicondyle fracture, supracondylar fracture, compressed cubital tunnel. So, this is all about ulnar nerve lesion at different level. So, you have to think um, low lesion, that means at wrist, and high lesion at the level of the elbow or at axilla.